Okay, well, as I said, I'm Matt. I'm head of placements and simulation at Newman University. I'm a nurse by background. I'm an adult nurse. So in nursing, there's different fields of nursing. So there's adult nursing, mental health nursing, children's nursing, and learning disabilities nursing. So I've been a nurse for 25 years. Clinically, I was a nurse, an emergency nurse, working in accident emergency and in private healthcare and for police custody. But I've been in higher education for about 17 years, working across different universities. I've worked at Birmingham City University and I've worked at the University of Wolverhampton. And in September last year, I came to Newman University, which is in South Birmingham in Bartley Green, to help set up the new School of Nursing and Allied Health. Don't know how many of you have heard of Newman University. We're one of the smaller universities in Birmingham, but we've been around since the early 1960s. I originally started life as a teacher training college, and Newman still has a very good reputation for teacher training, primary and secondary, and still does a lot of that. But about 2 years ago, the University Senate decided that it wanted to move into healthcare professional courses as well, and that's where we are. So we're currently setting up the School of Nursing and Allied Health. So we've got a fantastic simulation facility which we're building and expanding, which I'll show you more in a minute. And we are currently going through validation for our nursing and physiotherapy programs for a September 2023 start. So we're recruiting at the moment for a September 2023 start. Is the presentation changing as we go along there? Can you see?
Yes, it is. Thank you, Matt.
It is. Yeah, thank you. So just give you a bit of an overview there. We're planning on running nursing and physiotherapy. We'll talk a bit about what Newman University is about and what we can offer, and a little bit about personal statement and interview tips as well for those of you who are thinking of studying university. That's where we are, in the south of Birmingham, in Bartley Green. But we also occupy a space kind of on the border with Dudley and Halesowen as well. So we're kind of Dudley, Worcester and Birmingham. So we're kind of in that locality where we're sort of handy for a number of places, really. And certainly when it comes to offering clinical placements for our programs, we're looking at a range of partners. So not just the Birmingham universities, but we're looking at Russell's Hall in Dudley, we're looking at Worcester, we're looking at Wolverhampton, and we're looking at the whole Sandwell and West Birmingham. So across the whole of the patch, really. So rest assured that if you don't live directly where we are or directly next to the QE, that isn't the only placement that we're going to offer. There's going to be a range of clinical placements throughout the West Midlands. So a bit of background to adult nursing. As I said, there's 4 fields to nursing, and adult nursing is one of those. And what does an adult nurse do? Well, they care for adults of all ages. Pretty much, if you can think of a healthcare setting, whether that be a hospital or a clinic or a GP surgery or a care home, you'll probably find an adult nurse involved in care in some way there. Across a range of conditions, ranging from minor injuries through to acute and complex, again from a GP surgery to an intensive care unit, to rehabilitation, to theatres, to elderly care, across the whole spectrum, really. And the focus there is understanding not only the condition, but recognising the needs and the anxiety. So it's the holistic picture as well, looking after the whole person. As I say, adult nurses play that key part of that multidisciplinary team, and that means working with other healthcare professionals to offer the best care possible. And those are just some of the areas where you might end up working, but there's a whole host of other places you could. And you can see there the sorts of job opportunities open to you, from staff nurse on the ward to nurse practitioner to advanced clinical practitioner to working in a general practice surgery, even working on a cruise ship as well. The armed forces, prisons, private healthcare, residential nursing homes. Really, the world is your oyster when you're working as a nurse. Mental health nursing then, so this is another branch of nursing that we offer. So at Newman we'll be offering adult nursing and mental health nursing, those 2 fields of nursing, and you have to choose that field before you begin the program. So you can't do a little bit of it and then think, oh, I want to be a mental health nurse now, or I want to be an adult nurse. You have to choose at the beginning of that program, because although the program is similar in some ways and the standards that people have to achieve are the same, the placements will be different, and the focus of an adult nurse and a mental health nurse is different as well. As you can guess, mental health nurses have responsibility for looking after mental health, working across the whole of the lifespan, and working across people with a continuum of different mental health and illness problems as well. So again, you'll find mental health nurses working in acute mental health facilities, but also in clinics, in the community, in private healthcare, across the whole spectrum of healthcare. And again, there's just some examples there of where mental health nurses might work. So if you are going to study nursing, how is that delivered then? Well, nursing is an undergraduate university program now. and that's a 3-year course. And you could either apply directly through Newman if you wanted to only come to Newman University, or if you're putting down a range of universities and one of those was Newman, you need to apply through the UCAS system. So how's the program delivered? It's delivered as a mixture of blocks of theory and practice. So it's 50-50 essentially. So over 3 years, you have to do 2,300 hours of theory and 2,300 hours of practice to qualify as a nurse at the end of that. And at the end of that program, you'll qualify, providing you pass all of your requirements. You'll qualify as a registered nurse, either adult or mental health, but you'll also have a BSc healthcare, a BSc nursing degree as well in clinical practice. What we're planning to do at Newman is, of that 2,300 hours of clinical practice where we would send you into placement, we're going to use the maximum of 600 hours, which the NMC, the Nursing and Midwifery Council, will allow us as simulation. So this is when we get you into our simulation facilities, and we're actually using those replicated facilities that look like a real hospital, but we're actually doing it into simulated practice, and that might be role players, or it might be using mannequins, or the high-tech equipment that we've got here as well. And these pictures are the pictures of our simulation facility, of our hospital ward. And you can see the setup there in the top left. It looks a bit like an intensive care unit. The top right, we've got a rehabilitation facility with the patient to be hoisted. And the bottom left, we've got a physiotherapy suite there, where a physiotherapy lecturer is teaching students how to assess a patient in terms of exercise. And bottom right, we're talking about mental health and the skills related to there as well. So we're planning on using our facilities to augment that clinical practice. And that doesn't mean that you're not getting a great experience by not being in practice for that 600 hours of the 2,300 hours. It means you're getting something else in addition to that, really. Skills that you might find harder to get in clinical practice, or might see less often, or where, you know, they're high risk and you wouldn't necessarily get as much hands-on practice if you were dealing with a real patient. But in the simulation facilities, you can do that as much as you want, because there's no real patients at harm, and you can practice, you can get things wrong, you can learn from that, and move on. I'm just going to play a little video now. I hope this works, but this is a quick sort of fly through of Newman University, and it will show you our facilities. Hopefully that gave you a bit of a flavour of the campus. We're a one-site campus, so we're all operating on one campus, and the campus has a nice collegiate feel as well, which is sort of all together in one place. A little bit about funding for nursing and physiotherapy degrees. They are subject to university course fees, as any university programme is, so that's £9,250 a year, which you don't pay up front. You only start to pay that back once you're qualified and once you finish your degree, and only then it's a percentage of your monthly earnings every month, just as it is for any other degree. But the advantage of healthcare courses such as nursing and physiotherapy is that you get a £5,000 a year NHS bursary for each year that you're on the programme, which is £6,000 for mental health. You get an extra supplement for that. And if there are people who have children as well, they get a £2,000 extra on top of that parental responsibility allowance that's paid for by the government. So actually you get some cost of living expenses there that you don't get with other degrees. You can also claim expenses for some travel to and from your placement as well. You can claim that back. And obviously you've got the student loan system available around that as well. But there's lots of information on the web if you have a look at that in terms of university funding. I'm just thinking about how much nurses earn on band 5 and physiotherapists. Fully qualified nurses, once you come out of that programme, start on salaries of around about £27,055, which rises to nearly 33,000 on that band 5. But quite quickly, you can progress through those bands. So band 5 is a junior nurse, band 6 would be kind of a ward sister, ward charge nurse, and then you start to go up those bands. And the more senior you become, obviously, the more you can earn. And there's lots of opportunities in that. And when you start to go, up to the top end of that sort of nurse consultants and managers of services, 7 to 8C band, you're looking at the ranges of, 40,000 to 70-odd thousand pounds. So, I mean, you've probably seen a lot of media coverage recently, haven't you, about nurses striking and nurses, about sort of services and things like that. I mean, and I think there is absolutely something to be said for that, and I would support that. But nursing is a good career path, I think. And when you come out of that with a degree, employability in nursing and physiotherapy is something like 99%. The vast majority of people who qualify as a nurse or physiotherapist have already got a job before they qualify. They've already sort of gone through that process with the trust where they went on placements, the hospital trust, who usually employ most of the students have been in that trust. And trusts absolutely want to do that because you as students are their future workforce. So they want to look after you and they want to sort of encourage you to work within that trust that you've done your placements in as well. You don't have to work in the trust that you did your placements in. As a qualified nurse, as a qualified physiotherapist, you can work anywhere in the UK because your registration is the same, anywhere from Cornwall to Scotland and anywhere in between. But as I say, most student nurses tend to have a job arranged before they've even finished the course and go straight into that job. So employability is very high on one of these sorts of courses. And as we said, the career opportunities are fantastic as you progress through your career. Just in relation to entry requirements for nursing, we're looking at level 2 maths and English qualification, so GCSE level 4C and above. You have to have that, and you need 112 UCAS tariff points. How you get those, we're not that fussy about that. So it doesn't have to be A levels. It can be A levels. It can be T levels. It can be BTECs. It can be access to nursing courses. But you have to have something that gives you that equivalency to 112 UCAS tariff points. There's lots more information on the Newman website, and we hold open days regularly as well. So there's lots of information there. Just to give you some context of physiotherapists, this is the other program that we're running. So nursing is one program, physiotherapy is the other. Physiotherapists basically help restore people's movement and function when people are affected by various things such as injury, illness and disability. And they also help to manage pain, prevent disease and help people get back on that road to recovery using movement, exercise, manual therapy and lots of other things as well. And obviously these are the things that physiotherapists can do, making a difference to people when they need it most. Having that variety of, might be rehabilitation from someone that's had a road accident, or it might be someone that's had a stroke or something like that. And again, you're working as part of that multidisciplinary team, and there's lots of opportunity for career progression within that as well. But physiotherapy is a very hands-on profession. Obviously, you need to be passionate about working with people of all ages. You need to be keen to promote good health. You need to like solving problems and finding solutions. And you need to be motivated by seeing those results as well, which will help your patients to do. And obviously have an interest in human biology and anatomy and how the body works, because that's really important. You need to understand, the bones, the systems, the muscles that you'll be treating. again, the range of opportunities where you might work are very different and flexible, very varied. You might be working in an NHS trust, as we've said. You might be working in rehabilitation, or you might be working in respiratory, looking after patients in intensive care. You might be a physiotherapist to a national sporting team. So all of the national sporting teams, football, England, rugby, hockey, have got physiotherapists as part of that that sports management, sports injury team. You could be a physiotherapy lecturer in a university or a college. You could be working for a charity. You could be running your own practice. There's lots of physiotherapists who run their own private practices, who see patients privately after sports injuries and things like that. Or you could move into management as well. There's a lot of opportunity. Like nursing, there's a mix of theory and practice. It's 3 years full time, but there's less of a burden in terms of how much practice you have to do. With nursing, it's 2,300 hours. With physiotherapy, it's 1,000 hours of practice. We arrange all those placements for you. You don't arrange them yourself. We give you a range of opportunities. It's the same with nursing. You don't have to arrange your own placements. We do that for you. And we'll allocate you to those different placements to ensure you've had a rounded mix of different opportunities. And this is for Newman overall, really, because we're a smaller university, our numbers are going to be much smaller. So for nursing, we're looking at an intake of about 60 students, adult nursing students, mental health, 25 students, and physiotherapy, about 25 students as well. So you will be part of a small group. And the advantage of that is you will know the other people, the other students in your group. You'll know your lecturers, your tutors, and they'll know you by name. Which in some universities, some of the bigger universities, you may not get that because you're in a bigger group of 300 students potentially. They'll obviously break you down into smaller groups, but you're part of a much bigger cohort. Whereas at Newman, you've got that sort of small group effect and that level of pastoral care where you're able to know your tutors and we're able to know you as well. So I think that's a big advantage of Newman, of having myself worked at different universities. I think that's a really big attraction of Newman University. Something that's really important is thinking about this when you're thinking of both your application, your written application and interview. So for both nursing and physiotherapy, all of those people who interview, we shortlist them. And as long as you meet the requirements, and that's your personal statements as well, not just your qualification requirements, but making sure that in your personal statement, you've shown why you want to study a physiotherapy. It's important to try and weave these 6 values of the NHS Constitution in there as well. Something to think about. You can find this on the web. If you Google 6 values in NHS Constitution, you can find out more about that. But it's really sort of important to think about that. Moving on from that, some personal statement top tips. This is where you really need to sell yourself to us, to the university that you're applying to. You need to demonstrate how you meet the values of the NHS Constitution that I just mentioned, about how you personally, your skills, your attributes, your experience meets those values in the NHS Constitution. And then detail why you've chosen to study nursing or physiotherapy. And that's the thing, isn't it? Why do you want to study one as opposed to the other? And that's what you need to make clear to us. What qualities you think you bring to the nursing program or the physiotherapy program, and how you demonstrate these 6 C's and that experience. It's about using that experience and it may not have been direct care experience, so you may not have done work experience in a hospital or anywhere else, but it's about how you've used that experience that you've had so far in your lives, and that might be through clubs or looking after patients, looking after ill relatives or friends or something like that, family members. But it's about how those experiences you've had so far shaped your choice to tell you that you want to go into that chosen field, whether that be nursing or physiotherapy. And obviously the important one is to proofread it and get somebody else to proofread it for you as well. And like we said, you apply via UCAS unless you've directly applied to us, unless you've already had your results, but you have to have had your results to do that. We read all of those applications and we shortlist them, and any potential candidates we interview you. So we invite you to an interview to the university to have a look around, and a selection process, which is usually for physiotherapy, it's a short group exercise where you work together with the students, and then it's an interview. And for nursing, it's just an interview with someone like myself and maybe someone from one of the local trusts, one of the nurses, or a service user carer that we use as well. So people who've got experience of the NHS. And that's it really. So it's just to say that, Newman has invested a lot of money into its facilities. It's invested a lot of expertise into the programs that we're going to run. And we're really excited to be able to begin to offer those from September 2023 and grow from there. I'll take some questions now. If anyone's got any questions, I'll just have to stop sharing my screen though. Otherwise I can't see anything that's going on.
Thank you, Matt. That's absolutely excellent. Faye is putting in the chat there for us the open days that students can go on to and go and see actually the courses online, but also come along and actually see you, ask questions and speak to students, which is certainly the best way, I think, to get the real lowdown on what the course would entail. Can I just, whilst we're waiting for students, if anybody has any questions, to put those in the chat for Matt, as I know he has to leave after the presentation. And the 6 values that you talked about, interestingly enough, I know that when I was most recently at the hospital, those were actually on a screensaver of somebody who I was talking to. They were up there and they are the core values. So one of the things that I'd like students to understand is, as you said, about how to demonstrate perhaps some of those in their application best. Work experience is quite difficult to get hold of. Perhaps that, as you said, looking after family members, maybe working in a different environment, but getting those kind of skills and demonstrating the values. Can you just give us any more information on that you think might be useful, if there is any?
Yeah, I think you're right. It's difficult to get work experiences, particularly COVID. I think certainly changed the landscape for that, didn't it? Really. So it is more difficult, but it can be things like clubs that you've been involved in. You know, so you may have been involved in guides or scouts or brownies or something like that, or a youth club where you've had some sort of responsibility, or it might be in school, you know, or college where you've had a particular responsibility as well that went over and above, you know, what you would normally do. Whether you were a prefect or, you know, I don't really still do that. Do you still do prefects? I don't know. But whether you do, you know, monitors or things like that, or responsibility for clubs, that sort of thing. So it's kind of that thing that shows how you stand out a bit from other people, I think, is the key thing, isn't it? And helps you demonstrate those skills.
Yeah, and I think which applies to all of the healthcare professions that we're going to come on to, the paramedic, the pharmacy as well. I think anything that anybody can do in volunteering, you know, we would encourage students to volunteer or gain experience in first aid or St John's ambulance volunteering, as well as obviously anywhere in the community that can demonstrate those skills. So one of the I think conversations that was had prior to this, one of the questions is, what's the best way to gain work experience for physiotherapy specifically, as opposed to perhaps just the nursing? Have you got any ideas on that?
Yeah, I mean, again, I think it's difficult to get direct physiotherapy experiences in terms of work experience, isn't it? Because, you know, we're obviously trying to place students there as well from universities. But bear in mind that there are lots of things that are central to all healthcare professions, really, and that's things like communication and compassion and caring. So wherever that work experience might be, and that might be an elderly person's club or something like that. You might be helping with a lunch club, or, you know, helping you know, at a nursing home or a care home or something like that. Even if it's just to go in and speak to residents, it doesn't necessarily have to be the hands-on, you know, because you will find it difficult to get that sort of thing when you haven't, you know, when you're not part of the team, I suppose, in that sense. There's only certain amounts of things you'll be able to do, but those things like communicating with people, talking to people, and, you know, listening to people and helping them out in the smallest of ways is, I think, really valuable work experience across any of the healthcare professions, to show that you've been able to listen, you know, respond to people's concerns, help them, that sort of thing. So anything that gives you that experience, I think, is invaluable, really. It helps you to stand out again.
That's really helpful. And just from the point of view of students, we do have some online tools as well through our Padlet and through the healthcare pathway, where we can introduce students to a number of online work experience tools, as well as in-person opportunities. So I'd just encourage students for all of these healthcare professions to do that. Perhaps, Matt, if that's okay, if we haven't got any more questions right now, we'll you've kindly put your email, I can see, in the chat function, and we'll ask students to forward either to herself or to us any further questions. So thank you very much indeed for joining us, Matt. We really appreciate your time, and we look forward hopefully to getting some students to come round to Newman and come and have a look on the open days.
No, thank you for inviting me. That's really helpful. As I said, you know, the open days there. Thank you for putting those in. And we've actually got some taster days coming up in February and March. Have you got the days for those as well?
I haven't, but we'll come up with those. Actually, perhaps Faye will link those as well in the chat function, so that, and we'll send this round afterwards as well. So that's really helpful. Thank you, Matt.
Thank you very much.
Thank you very much indeed.
Take care.
All right. Thank you. Bye-bye. Bye. Hi, Zaf. Nice to see you. Thank you very much indeed for coming on. Students, this is Zafreen Khaliq, and we're delighted that she's come to talk to us about paramedics and routes into that, careers and her experience, and some hints and tips, I think, generally on that. And we'll ask for Q&A afterwards as well. Zaf, I'm going to go off camera now and leave you to talk. Thank you.
Thank you very much. So as Louise has already introduced me, my name is Zaf and I'm a paramedic. I'll talk a little bit about myself, but I'll do that towards the end, and I'll go through the presentation first. I'll explain why I'm going to do that as well towards the end. So I'll just share my screen first. Can everyone see my screen?
That's great. Thank you.
So first of all, I'm just going to talk about what paramedics do. So everyone has kind of an idea of what paramedics do, but I think in reality it's probably a little bit different to what everyone expects. So what I put up there is kind of like what you would see in all of the papers, and it's kind of all the stuff. So in reality, as I've done the job, it's not all blood, guts and gore. We attend a lot of non-emergency situations as well now. So stuff like acute medical conditions, social needs, mental health patients, elderly falls and inter-hospital transfers. But most of the time we're in a very unique position and we help people out when they really need it. And that's where we get our most kind of job satisfaction. So there's obviously downsides to every job. And one of the biggest ones that I would say in the paramedic profession is the fact that we work 12-hour shifts, including days and nights, bank holidays. This brings with it kind of a lot of fatigue. So you have to kind of develop a really quick kind of work routine and a decent work-life balance. But the best thing is that we help people. We've got to be caring, we've got to be compassionate, we've got to be good at communicating, and we've got to be really good listeners. So as they were talking, it's all about the NHS core values. So how can we become a paramedic? So there's two routes to becoming a paramedic. The first route is direct to university. So it's now changed from a foundation degree to a bachelor's degree. And then the second route is the student paramedic programme within the ambulance service. So if you do the bachelor's degree, your first 2 years will be the foundations of becoming a paramedic. You'll get regular placements and mentorship with the ambulance service and working alongside an experienced paramedic. The third year, the extra year now, is where they teach you all about the minor illnesses and injuries. So a lot of people think that, why are we doing an extra year when I only need 2 years to become a paramedic? But the third year kind of gives you an insight into primary care and urgent treatment centres and a lot about minor injuries and illnesses. And that's where kind of the paramedic profession can lead you to as well now. And I'll talk about that a little bit later on. And then via the route 2, so you'd be employed by the ambulance service on what they call an apprenticeship programme, and you'd be working for them. So the first kind of year of your training, you'd get directly with the ambulance service. And then in the second year, they'd get you a placement at a university that they work with. And then you do the first and the second and third year with the university whilst you're also working, and they'll give you kind of the study leave to go to university to do that. So pros and cons kind of each route. One of the biggest pros of going direct to university is that when you are on placement, you get all of the time in the back with the patient. You get a lot of mentoring with your mentor, so they're with you every patient that you're with. A lot of people can see that as kind of a con as well, because it means you're never really on your own and you've always got someone to fall back on. One of the biggest pros of working with the ambulance service is that you're getting paid through the whole time whilst you're doing the course. But obviously the con of that is that because you're a driver and you're employed by them, and you can end up in a scenario where you are treating, but then you need to end up driving, and then you have to leave the patient, and it kind of cuts in a little bit in your learning and the kind of patient care and stuff. So just to move on. So then this is, I'm not going to bore you a lot about the entry criteria. It's kind of basic as to probably the most of the NHS. So you need at least 5 GCSEs, grade 4 or C and above, including your English, maths and science. And then you need 2 or 3 year levels, including a science or equivalent qualification as listed on here. once you have become a paramedic, you have to register with what we call the Healthcare and Professions Council. This is a professional registration, and we have to comply with the standards of proficiency. Some of these are to practice as an autonomous practitioner, provide mentorship, and maintain our own continuous professional development. Now there's a newly qualified paramedic program. So this is like a 2-year consolidation period where you have to complete another portfolio. I would kind of recommend that you do that with an ambulance service because it kind of gives you a lot of frontline exposure, and they've got kind of a program where they help you through that portfolio and stuff and give you the hours that you need. Obviously, completing this means that you're also complying with one of the HCPC standards of proficiency, which is your continuous professional development. So there's lots of career progression now from being a paramedic. So it takes you to all sorts of places. So these are the kind of career progressions you can do within the ambulance service. So critical care paramedics work on the helicopters with on the air ambulance, and heart paramedics are the hazardous area response team. So they've got a little bit more skill set, so they can go to a lot more of the hazardous stuff. There's obviously a lot to do in management. You can become a research paramedic, you can become a lead in clinical, you can become clinical team mentors, you can even move into the education training officer. A cohort paramedic is a brand new role where we are working alongside the hospitals to try and help with the delays, and the hospital ambulance liaison officer is also based in the hospital to helping handover and stuff. And then these are a lot of the career pathways outside of the ambulance service. So you can become a paramedic prescriber, you can become work towards advanced clinical practitioner and an emergency care practitioner. So these involve completing more degrees. Then you can become a disaster paramedic, resuscitation officers, you can become a lecturer, you can become first aid trainers, BLS trainers. There's a lot of event work out there for paramedics. Emergency assessment practitioners is again a brand new role. It's like we're recognised to triage really well in hospitals. First contact paramedic practitioners is the new role that they've got for paramedics in primary care. Then there's a paramedic roadmap to practice. So this is the employing paramedics in primary care. It's a brand new thing. So they've took out a kind of roadmap. So it helps us transition and it helps our employers transition as well. It involves completing a level 7 module at university, which is called the first contact practitioner module. And then you can move on to either completing a master's degree in advanced clinical practice or doing a portfolio route towards that, or doing your level 7 non-prescribers module. These are all optional. You don't have to do any of them. So as I said, I was going to talk about myself towards the end. So I'm a paramedic. I have been for the last 10 years or so. I joined the ambulance service in 2013 on a student paramedic course. And I completed then the foundation degree at that time of the University of Worcester in 2015. I got my registration in 2015. About 18 months ago, I moved into primary care and I qualified as an FCP. And I've very recently begun new employment in a hospital as a trainee advanced clinical practitioner. And we'll be looking to complete the master's degree in the near future. The reason I spoke about myself towards the end was so that I wasn't given a biased opinion at the beginning, and I was kind of giving my honest opinion about both routes, because I've mentored students that are direct students from university, and I've mentored students who have been in my position, and obviously I've did that route. So I've tried to give you the best kind of snapshot from both aspects rather than trying to stay biased about it. Does anyone have any questions?
Thank you, Zaf. That's really helpful. It's good to see from somebody I know who's practiced for, being a professional for so long and involved in so many different aspects of working in as a paramedic. One of the things that'd be really interesting whilst we're waiting for anything in the chat is just to ask you whether you think that being a paramedic is going to change over the next few years. There's obviously, at the moment, we can be very honest about some of the unrest that current ambulance workers are experiencing. Do you think that the satisfaction level that you get from the job you know, is commensurate with the way in which, you know, things are run at the moment. I'm not asking for a political statement, but literally, you know, how do you feel that the future looks for would-be paramedics?
So the 21st century paramedic, as I said at the beginning, is very different to how people would have imagined it many years ago. So we're not just there for emergency situations anymore. We do a lot of primary kind of situations. There's so many pathways open to us now. I think I'd say to anyone, if they're kind of looking to join kind of the healthcare profession, they're interested in the paramedic profession, but they're worried about the fact that they might not be able to do it for a long time because of the lifting or handling or the 12-hour shifts, then I tell them to join and then think about the majority of pathways that you can lead them to afterwards. Because as I've said, and as I've listed, there's loads and loads of thingies and everything. I chose to go into primary care because I wanted a better work-life balance. Other people choose to do the critical care paramedics or emergency care practitioners because they prefer that side of it and they don't mind the shift work as much, or they want to work alongside and they want to stay in the emergency side of it. There's so many routes to take. There's triage roles in hospitals. We recognise more now than we ever have been before. So I think that's a really, really good thing. So I'd kind of recommend to anyone to just think about it and think about, I think a lot of people, they don't think about where their career is going to go in the future, and think about what they want out of the career, not just about not just about the fact they want to be a paramedic now, is where they want to be in 10 years time. And if they join with that plan, they're going to know how to get to there, so they'll be absolutely fine.
I think that's really helpful, because I think all of us probably have a very limited view of what being a paramedic might be about, and what you've explained is actually that the roles have changed, they are going to continue to change, and that actually the responsibility levels are you know, across a lot of the primary care as well. I know on the ambulance itself, before patients go off, there's a considerable amount of work that's done at that triage stage, you know, that students will probably not even know about at this stage. Just out of interest, one of our students has asked, thanking you very much for your talk, and ask if the BSc qualification is with both routes into the paramedics.
Yes, it is. Yeah, so with both routes now, it's a BSc. I think the ambulance service have tried to see if they can get away with the foundation, but they can't because it's come from the top. So yeah, so you do, when you join the ambulance service, you still get the bachelor's degree at the end. The first year you study with the ambulance service, and then the second year they get you a placement with the university, and then you complete your second year and your third year at the university, and then come out with a bachelor's at the end of it.
That's really helpful. And Faye has been putting in the chat there some job role information, and also about the degree and various courses as well through the NHS. That's really helpful. And whilst we're waiting for any other questions to be in the chat, perhaps I can go on to meet with Henna, and we can ask her to do her presentation. Are you okay to hold on, Zaf, till the end? Is that all right? That'd be really helpful. Thank you very much indeed, Zaf. And students, do put any further questions in the chat for Zaf, and we'll come back to them. May I welcome Henna. Henna, thank you very much indeed for coming online today with us, and for your presentation you're going to give on pharmacy. We shall look forward to asking some questions of you a little later. So I'm going to leave you now, and thank you very much indeed for joining us. Thank you, Henna.
Thank you. Yeah, my name's Henna and I'm representing pharmacy. So what is pharmacy? Pharmacy is the science of preparing and dispensing medical drugs. So we are generally out there, like you'll probably know us as pharmacists, but we also work in different sectors. So I'll go through that in a second. What are pharmacists responsible for? So we're responsible for medicine supply to patients in a legal manner, ensuring that their supply of medicines is within the law, ensuring that the medicines prescribed to patients are suitable, and advising patients about medicines, including how to take them, what reactions may occur, and answering any patient questions. Where do pharmacists work? So you may know like the pharmaceutical industry just to be something like Boots or a Lloyd's, but we work in various different places. So pharmaceutical industry is pretty large. Not only do we work in community pharmacy, we work in hospitals, ensuring that the doctors have prescribed what is that is suitable for the patient. In the last few years, we have heard about Pfizer and AstraZeneca. So we also work in within the research side of things. We work in prison, we work in primary care, we work in university, we work in military, veterinary, and other pharmacy organizations. What is the route into pharmacy? There is actually no set route, but each pharmacy, like each university, will have their own criteria. Unfortunately, there is no apprenticeship route to pharmacy because it ends up being a master's in the end, but this is generally what is required. I would recommend highly, if you want to work in this profession, to do work experience. Now, to do work experience in pharmacy, there are some protocols, but if you state that you want to work within the medicine counter side, there'll be somebody with you at all times who'll be able to help you. So you'll be helping patients like with minor injury, like minor queries. You'll be helping out just grabbing some prescriptions. You'll be helping the pharmacist just organizing things. So that's a sort of extra help that we always need. So if you are looking for something like that, then just ask in the chat and I'll tell you how to do it in more detail. Now, the working life, the positive sides, it's a creative career option. It's a competitive salary. You can own your own pharmacy. You can be a locum, which basically means you can work flexible hours and you have travel opportunities. The negative sides, you can work long days. So like Zaf, you can work up to 12 hours. We don't do nights generally, but there are now some pharmacies that are open 24/7. So there are some pharmacies now that are asking for night shifts. It's extended schooling. So most of the time schools are like your university is done after 3 years. It's actually 4 with pharmacy because you get your masters at the end. It can be competitive to get onto the course. So don't be disheartened if you don't get on straight away. You can always go back. There is physical fatigue. You're on your feet all day. You're mentally tired as well. And it's high pressured environment. So you're always ensuring the medication dispensed is accurate at all times. What are the must-have skills? So these are the top three skills that I would say that you actually need in pharmacy. So you need to be able to communicate. You need to be able to work with different team members, and you need to be able to pay attention to detail. So what do I do? So I'm a locum now. So I've done my time doing full-time pharmacy. I'm now a locum. This means I do not have a set contract. I just pick up shifts as and when I feel. And that suits my home life balance. I also work as a project manager within a global company. So I work with various teams across different countries. So sometimes I'm talking to America, sometimes talking to Australia, sometimes in UAE. And the other thing is as well, you're always learning. So within pharmacy, you're never not done. You will always be learning. And does anyone have any questions? Mine wasn't as long.
That's all right, Henna. That was super. Thank you very much indeed. Please, students, do put any questions in the chat, but I've got a couple of questions, if I may, in the meantime.
Yeah, sure.
Can you tell us a little bit, Henna, about the experience, perhaps thinking that our students are at this stage doing A-levels, looking forward? What do you think are the best ways that students can prepare perhaps to go into pharmacy, and what kind of experiences must they have or can they have that would help them on the road to understanding what pharmacy is more about?
Okay, so what I did, I ended up going to my local pharmacy and I worked there on a Saturday for 2 hours. Every Saturday. And then I got some experience in that. Then I increased my hours and then I ended up doing my A-levels. Once I got my A-levels through and I was at university, I was able to just have a nice smooth transition over. But I knew what the job was going to entail in the first place. So it wasn't a surprise to me that it was long hours, that we are going to be tired by the end of the day, what goes on behind the scenes. So I would really recommend people doing work experience. It's not what it seems on paper. Yeah.
students have been asked to try and obtain some work experience over the next few weeks if possible, but certainly you know, by the time they leave college, we want all students to have had experiences in the workplace. And I wonder if both yourself and Zaf can just talk a little bit about what it's like, you know, a day in the life of almost, and how that kind of looks. I know it varies from day to day, but you know, perhaps you can tell us a little bit. Zaf, would you perhaps do that first?
I'd love to talk about my day as a paramedic. I think I can only describe the paramedic profession as the best job in the world, and a part of me is really, really sad that I've left it behind. So when you're a paramedic, you turn up to your duty at your allocated station, you're allocated a crewmate for the day, and you're allocated a truck as to what you're going to be working on, which is normally kind of prepped for you. So you know where everything is, they're all set up the same, etc. You know what's in the bags, you know where everything is. And you go get, as a paramedic, you have to sign out kind of the registered drugs, which is the morphine and the diazimols, etc. So you would sign them out and put them onto your truck, and you'd put the key on you. The rest of the drugs are in the bags, and everyone knows where they are. You then book on with the control. You let them know who it is, who you're working with, where you're working from, and what your truck number is, so you're identifiable for the day. And then they send you a job. And the jobs are categorized in categories. So we have category 1, category 2, category 3, and category 4. Category 1 is the highest category, so life-threatening calls. And then category 2 is a little bit below that, so your chest pains, your strokes, heart attacks, that kind of thing. And then your category 3 are more of the mental health patients, abdo pains, and elderly falls with injuries. And then category 4 is a non-emergency category, which is for falls that have got no injuries, but it's really hard to identify that, so we very rarely use that category. And then for all the first 3 categories, we have to be traveling on blue lights to all of the patients, and then once you get there, you kind of it comes through on kind of an AVL system. You tick that you're ready to go, you start driving to the job, you follow the sat nav, it'll take you where you need to go. And then when you turn up, you always go in with a monitor, which is your defibrillator, and it does all your observations. And then you have what we call a BLS bag, so it's got everything in there that you can probably think of, from emergency stuff to non-emergency stuff as well. So it's got a little bit of obs kit, it'll have all of your airways in there. It's also got kind of your sharp spin, it'll have your cannulation stuff, your airway stuff. It'll have a suction in there, it'll have BVM, so bag valve mask, if you need to resuscitate anyone. It's got a little bit of PPE in there if you need to use it. Back in the days when we didn't used to wear it as much, now we wear it as we're going in. So yeah, I think that's kind of about everything that's in the bag. And then you open and use what you need to. You go in, you take an assessment. You kind of is usually kind of what we call a dynamic risk assessment. So quite quickly, you need to make your mind up about whether your patient needs something really quickly, or we can take our time with it. So whether it is what we call an emergency or a non-emergency, you will have a little bit of notes, but we don't get a lot. And from my experience, the notes are never really correct anyway, because there's a big kind of error in communication when people call. As you can imagine. And then you just clear from that job when you're ready. You do the paperwork before you clear. You sign that off. It's all on electronic now. And then you clear. You can let control know that you're either traveling to hospital or you're leaving them at home. You let them know what's happening. You go to hospital. If you're arriving at hospital, you go in. You hand over. If there's any delays, you wait on an ambulance. And then if not, you hand over, or they'll direct you to a certain department, or they'll already be booked into a department, or you'll either be alerting them in. If you're alerting them in, and because you're worried about them clinically, you would then call up first and let the hospital know you're arriving. They should have a bed ready, not always in these situations when they're really busy. And then you then move on to the next one. And your day just kind of keeps going on like that. You can end up out of area, really, really out of area, or you can stay very local. The jobs could be really, really varied. You can go from being kind of saving a life at one point to not saving a life and sitting on someone's couch having a conversation about something really random. Just, helping the elderly, making them a cup of tea because it's more of a social call, or because it's mental health, you'll be sat there talking to them, trying to give them kind of techniques as to how to cope, and trying to kind of navigate alternative pathways. So yeah, it's very random. It's, like I said, the best job in the world. You will have the best time if you're a paramedic. You will make the most amazing memories and you will meet the most amazing people, because that's what I've done in my job.
That's just, I mean, I love the enthusiasm that comes over, and I know both yourself and Henna, representing your professions, have had, you know, experience over the last few years, as I've known you for some time, both of you, that actually, you know, it is a vocation, both of them are vocation, but you can make a big difference to people's lives as well. But it also has a huge impact on your own life, and some of that can be stressful, but there is also the reward of doing both of these roles. Henna, can you tell us a little bit about perhaps, you know, the kind of day you might have?
Yeah, it's not as exciting as a paramedic, but but yeah, so I do have an interesting life. So basically you get in, you have to be on time. So if you're never on time, that needs to change, because the NHS contract starts the minute the contract starts. So if they say it's at 8 o'clock in the morning, you have to be there for 8. So once you've opened up, you have to do a quick check to see that no CDs have been taken. Make sure no medication has been taken overnight, and make sure the fridges are still working. So once you've done that, you work with your team for the day. So I work as a locum, so that means trying to get to know who I'm working with. If you're a salaried pharmacist for the day, then you would be speaking to the regular team on a regular basis, so you know what's going on in the store. So for example, when I go in, so last Saturday, for example, when I went in to work, it was chaos. Nobody knew what they was doing because all 3 of us were locums. So you just find the common ground, see what needs to be done, prioritize, and just go with that. So we also have flu vaccines at the moment. Sometimes we do other vaccines as well, like travel. So you need to make sure that the patient is suitable. We also do clinics where we speak to people and see what's bothering them. So people come in, they talk to us about their medication. So if little Miss Doris doesn't like taking amlodipine, for example, a blood pressure tablet, if she doesn't like it, we say to her what's going on, what's happening, and we could liaise with the doctor and see if we can get her something else. So that's another service that we have. We also have 111. So 111 book in and say to us that this patient's coming in, they've just got a minor illness, are you able to help them over the counter? And then if we can't, we either call ZAS team or we contact GP, or we send them off to another route that's suitable. Then by about lunchtime, this is another thing as well. Sometimes you get lunch, sometimes you don't, depending on if you've got enough staff. If you have staff, then you have a lunch. If you don't, then you have a working lunch. So you're constantly eating a sandwich whilst like checking something in the background. The other thing that we also do as well is repeat prescriptions. So whilst everything else is going on in the background, we also have repeat prescriptions coming in from the GP. So the GP is prescribing everything that's coming through. So we've got a team like the dispensers and techs, they deal with that on that side. The other thing I'd say as well is if you didn't get into pharmacy, for example, this happens to a lot of people. If you don't get in pharmacy first time, just work in a pharmacy anyway for up to a year, like have your year out and train up to become a dispenser or a technician. Your pharmacy will train you, like they'll take that on. And then once you become a dispenser or a technician, and if you wanted to become an ACT, that's not a problem either. It's a level 3 that will work towards your UCAS points as well, and that will help you in your first year. They may be able to like negotiate your first year for you as well. And once you've done that, then you've got a job set for life as well, which is the route that I took. So once you've had your lunch, then we go back into checking any of the fridges, CDs, anything else that is important for the day. We make sure all the prescriptions are done for the day as well. So if there's up to 200 or 300 per day, so that's 200, 300 patients just on paper, excluding anyone that you see. Double check the clinics, and then end the day. That's pretty much us.
That all sounds very busy. I like the idea of a little bit of lunch. I'm not sure whether students will appreciate how hard that is, though, to take during the day. And I guess as well, both of you, in the foreseeable future, we talked about, perhaps the future of some of these professions and how they might change. And obviously the pandemic massively changed both areas of work. But pharmacists, as you say, we're giving COVID jabs and all sorts of things, and provide a triage service in similar sorts of ways, different, I know, from the emergency situation. But nevertheless, how do you keep up to date, Henna, with your practice and your profession?
So there's a lot of discussion that goes on with different pharmacists. So you do a lot of CPD, so continual professional development. So you'd often see me in the evenings just on my laptop, just double checking what else is there that's new out there. Like the other week, we've got 2 new drug reclassifications. So that means I need to learn up about it and then teach the team. So yeah, you constantly CPDs, you get emails left, right, and centre all the time.
And perhaps we haven't got any further questions at the moment, and Faye's been putting useful links in the chat function, and students can obviously send questions to us at careers@kets.ac.uk, and we can forward those on to you if we may. But perhaps I could ask both of you to sort of finalise the session with perhaps one top tip that you could give to students. I'm putting you on the spot, but one top tip that you could give to students thinking that they are currently perhaps in year 12, they're coming towards thinking of their exams, and thinking about making some inroads into going to open days and making some choices about what they do. What could you give them? Zaf, would you give them one top tip that you might give them about making a career choice?
Oh God, I personally think that it's really young to make career choices at 16 and 18.
I agree.
I think it's far too young. And people probably with life experience, you should probably make better choices. But anyway, we're here now, and that's the way we do it in this country. I would say whatever career that you're interested in, learn about that career. So maybe get work experience in it, or speak to someone who's already doing it, or trying to get the reality of it. Everyone has like an idea of this is what the profession looks like, but in reality it's always very different, and that's why I've tried to be very honest about the paramedic profession today, and learn about where you want that to go in so many years time as well. I think that's really important as well. But like I said, I think it's really early to make such big decisions in life. I didn't do the paramedic profession until I was about 27, so I think it's really hard to make those decisions really early. But once I'd made that decision, I knew it was what I wanted, and I worked very hard to get onto the course and to then therefore to be where I am now. And I think just be motivated in what you want to do, and you will totally get where you want to be as long as you're motivated, and kind of said do some research about it. And I think it doesn't matter what you do in the NHS, you can never go wrong. It is a job for life. It's got a lot of negatives at the minute, especially with everyone being on strike, but it is a job for life. It is amazing. It is a vocation. And it doesn't matter what part of the NHS you are, you make a difference. And people do appreciate us. So don't think of the NHS as a very negative thing, because it's not. It's an amazing vocation for life.
I think that's a really, really helpful kind of way of putting this, and encouraging students perhaps as well to think more long term, not just the immediate. And actually, one of the things as careers advisors, we ask students what their aspirations are for 5-10 years time, because actually, as you say, it is a very short term to start thinking this is what I'm going to do for life. At the age of 17, that is probably unlikely that you'll get to the right conclusion. So there's lots of changes along the way. So I would encourage students to talk to as many people as possible in the professions, and obviously, as you say, to investigate, but to have some faith actually in kind of taking a chance on a profession and really making it work and getting to the path that you want to get to eventually. Henna, can I ask you as well what you would say?
I would say work experience too. I think work experience is key, because what you see on the TV, in American TV shows, it looks all fun. But you need to go and see what it's actually like. Like, you can speak to different teams. So like, you can speak to the dispensers. You don't have to just speak to the pharmacists. Speak to the dispensers. What do they do on a daily basis, and what do they do to help within the team? Then you can speak to the technicians, you can speak to the pharmacists, and then you'll get a broader understanding of what actually happens within pharmacy. Some people think it's just sticking a label on a box. I assure you it's not. There is a lot of mental stress behind it as well, because you have to make sure that whatever you're doing is always accurate. So if you're not feeling well for the day, if you've got a migraine, that obviously affects the team. So it's always good to like have a nice team behind you as well. You're never going to go wrong. That's the other thing with pharmacy. You'll never go wrong. I've left working full time just for a better work-life balance, just like Zaf did. So I work from home now, so that's also a possibility that it wasn't before. So COVID did help in some ways. So now we work from home. So yeah, I'd say work experience is the main one. And plus you're young. Like don't think everything's going to be smooth sailing. It never is. My 30 something, trust me, it's been like this. It always happens.
I think again that's a realistic approach, isn't it, towards a career path, which actually a career path usually takes a lot of twists and turns. But I'm really encouraged, thank you both, because I think students, you know, hopefully you can hear it from both Henna and Zaf, and also from the education side of the more academic side from Matt originally about the nursing side of things. And I would encourage students, we are holding some workshops for gaining work experience, and although that's difficult in some cases for in-person work experience, we are holding some workshops, and there's plenty of information also on the careers section of the website. So I'd encourage all students to take a look at that, and also to come along to one of the workshops that we're doing. And also, we have Apprenticeship Week coming up in early February, which is a national apprenticeship week. And of course, I know that, you know, there are obviously apprenticeship routes into a number of the healthcare professions, some of which we've covered this evening, but there are plenty of those. And I'd encourage all students to participate in and attach themselves to some of the online materials and resources, and, you know, talk to people as well through that. And then later on, going into March the 16th, we have an employer fair, and we will be having Henna, Zaf, and other representatives from many professions across both the healthcare and other professions coming in the evening to be available to talk to. So I think both of you have suggested getting stuck in to talk to people, getting some experience under your belt where you can, asking questions. Students, I hope that you've enjoyed this evening, and I would very much like formally to thank Zaf and Henna as well for coming, and obviously Matt previously as well from Newman. Any further questions, please email careers@keds.ac.uk, and we look forward to catching up with Zaf and Henna at our future events. Thank you very much indeed for this evening, and thank you to Faye for putting all those links as well in the chat. Students, if you've got any further questions, you can come along to DD 0.07 Daisy Drewler Building, or email us. Thank you all very much for attending this evening, and we look forward to sending around this recording as well. Thank you for the evening. Take care. Bye-bye.